Good morning. My name is Jeanne Chibungu, and today we're going to talk about the health literacy. The presentation is as follows. First, we're going to be talking about the two key areas of concern, then the key communication principles, the recommended best practices, and a small group exercise will be also following, and we will have the bibliography. The two areas of concern in health literacy I've chosen to talk about today are the medical label and the schedule of taking the medication, which is sometimes very difficult to understand, the hard to ask for clarification by patient to the health provider. The importance of these two key areas are due to the fact that regarding the label, for example, the medication label, there a problem that the outcome could be very bad. People can die, and many times patients don't know really how to take their medication, and sometimes they don't even take it. They are not taking it. And they need a good literacy to understand what is written in the label. And we have seen that many times the adverse drug events that are happening are due to the outpatient med error. For the hard to ask clarification, it's important to talk about it because providers don't have the time, and many times also patients are ashamed to ask for clarification, and our health system is very complex. We have a cultural diversity which need to be addressed, and we know that the patients have to be participating to their healthcare and to know what's going on with their health. What is the definition of health literacy? It's a shared responsibility between patient and the provider to communicate the health information, to allow to take the good health decision which will promote the patient well-being. The key communication principles are that at the national level, we have policies, programs, and interventions that are implemented. We have the National Action Plan to improve health literacy. And the National Action Plan, which consider that the language and literacy are social determinants of health. Therefore, it promotes a patient-centered care with the goal to provide accurate, actionable health information and support lifelong patient learning and skills to promote good health. The Agency for Healthcare Research and Quality gives health professionals tools and give information to improve health literacy. NIH applies the Clear Communication Program based on research, and it helps health communicators to overcome health literacy barriers. The FDA Strategic Plan for Risk Communication of Regulated Products is another national program which is very interesting and which is applied. You have also now the Health People 2020, which has the goal of eliminating health disparities by trying to achieve health equity. Its other goal is to improve healthcare services delivery and ways of giving information and communication with emphasis on use of plain language. The Office of Minority of Health contributed to the creation of the Center for Linguistic and Cultural Competency in Healthcare. It provides the state with the interpretation and translation services in person or through phones and information material and documentation. What are the methods aligned? We can find that for the medication label and for the patient how-to-ask question, we need to use the plain language. There's also the teach-back technique application where the provider makes sure that the patient has understood the information and can repeat what the provider has told him. We have the interpreters used, and we need to know our audience language and culture. Regarding the how-to-ask question, the provider need to invite, even insist, patient to ask for question. He can use the open-ended question, he has to offer reassurance, and ask as well answer. And also we have to take care in account the patient emotion and help the patient ask for questions. What are the best practices that are recommended? First, we need to avoid using jargons, utilizing complicated medical words, abbreviation, and being judgmental, belittling. We should also avoid to use too long sentences, very complicated words, and we have to be careful not to take for granted that the patient is understanding what we are saying. Sometimes he can just nod and say yes, yes, just because he wants to stay polite with the provider. And also we need to avoid using abstract image or symbols. And we have 4 ethical principles that we need to apply, like we need not to harm. And it's also harming a patient when we are not giving him the health information that he needs because of time or whatever reason. We have also to give the patient the benefits. We have to help him. We have to think about what is the best way for him to feel better. And we have to respect his autonomy. He's independent. He has the right to choose not to follow completely what we are telling him. Our role is only to give him the more information we can to help him understand what he's going through and what are the solutions that are available. And regarding the justice, it's the right for the patient to have the best of the healthcare that we know about, and also the right to not be discriminated in his right to have access to the healthcare and the healthcare services that are available. And the health literacy is part of that. Regarding the small group exercise, we will be performing role play. We have 2 participants per group, and as the participants are performing their play, the other colleagues will be observing, and after that will give their feedback to the players. Then we're going to be having a summary, and the teacher will wrap up. The role play will be between a provider and the patient. The provider will be reading the label and make sure that the patient understands it. And after that, the patient will be invited to ask for questions, and the provider will talk with him in plain language. That's what we're going to be observing, and after we will give him our feedback. We will give them our feedback. Why are we having a play role about these 2 key areas of concern? Because 9 over 10 patients don't understand that information. The providers don't even know that there's a problem, and they don't listen to their patient. There are culture barriers that need to be addressed, and we have an increase in med error with emergency room visit and many bad outcomes and even death. The material that we will need per participant will be a sheet of paper with information about the medication, about diabetes or hypertension. You're going to be choosing one of them. And then we have 2 empty labeled bottles of med, 1 pad and 1 pen. And the exercise, as we said, will be a role play, which will take 10 minutes. We have 5 groups of 2 participants each. And after the explanation of the medication and the invitation to ask for questions to the patient, the provider will summarize what they have been talking about to his patient. And then the colleague will give their recommendation, and we're going to be discussing what has been happening in the role play. After each role play, we discuss. At the end, all the participants will be divided in 2 groups, and they're going to be discussing a little among themselves, and then make a presentation about the principle, the strategy, and how the med labels and how to ask questions have been discussed. And after that, we will be all the participants will be filling out a form about the evaluation of this training, and the teacher will wrap up at the end of this exercise we have been doing at the end of this training. Thank you for your attention, and if you have questions, I'm here to answer to all your questions. Thank you for your time. Thank you.